Good morning. I call the San Francisco Human Services Commission special meeting of Wednesday, February 15th, 2023 to order. It is now 9:40 a.m. and I am Scott Kahn, the Human Service Commission President. Elizabeth, will you do the roll call?
Yes, please respond with present when I call your name. President Khan. Yep. Vice President McCray.
Present.
Commissioner Semmel. And then virtually we have Commissioner Kogla McDonald.
Present.
Thank you. And Commissioner Singh. You can raise your hand if you're having trouble with mute. Okay.
We have a quorum. Item 2 is the adoption of the agenda.
For a motion to adopt the agenda.
So moved.
All in favor?
Aye.
So moved. Are there any comments or questions from the commission regarding the agenda? Is there any public comment? We're going backwards here now. Hearing no request to speak on this item, is there a motion to approve the agenda?
Yeah, so moved.
All in favor?
Aye.
Sorry about that. Item 3 is the adoption of the January 26th regular meeting minutes. Are there any questions from the commission regarding the minutes? Is there any public comment? Hearing no request to speak on this item, is there a motion to approve the minutes?
Second.
All in favor?
Aye.
So moved. Item 4 is our executive director's report. Mr. Rohr?
Yep. Good morning, President Ron, Commissioners. We just met a couple weeks ago. The report will be a little shorter than normal, but so it is. Start at the federal level. I want to report back on this just as a reminder, because I did raise it last month. As a result of the Federal Budget Reconciliation Act that passed either late December, early January, the CalFresh emergency allotment, or the increase in CalFresh benefits that was put into place under the pandemic, will end in March. March will be the last additional payment. It's about $160 a month per household on average. And so in April, the lack of that payment will begin to be felt by our recipients. There's been a lot of activity at the state level and in counties across the state. A lot of press have been covering this. And there's been sort of responses from the state and also a local response that I just want to bring you up to speed on, because it really is a big deal for our families and our single adults who get CalFresh, our seniors, as well as on the local economy. It's about $11 million a year, or excuse me, a month in food purchasing through CalFresh that will be lost. So the State Department of Social Services has launched a campaign to inform every CalFresh recipient across the state of the change in federal policy. HSA, so locally, will amplify the state's messaging in our various languages. So English, Spanish, Chinese, Tagalog, Vietnamese, and Russian. We'll do that on our website. We'll do that on lobby signage, phone tree messages, in our online benefits portal, our service centers. And then in February, we're also engaging the community in outreach efforts, providing CBOs or CBO partners with talking points, flyers for their staff, presenting at community forums like the San Francisco Food Security Task Force, really doing all we can to get the word out. I sent a memo. I certainly briefed the mayor and her staff, but sent a memo to each member of the Board of Supervisors, one of whom wants to meet to talk about the impacts and see what sort of response the board might have in terms of backfilling, at least partially. So just sort of as many sort of paths to get the word out as possible in the immediate term. And then sort of next month, we'll reach out to the community again via the news media. And there have been several stories locally as well as across the state We're going to be doing direct texting, direct mailings, of course, all delivered in the appropriate languages. And then as the policy goes into effect, so as it's felt in April, we'll refer clients and CBOs to our locally funded or HSA funded food support network website. Also 311 will have information on where to direct people to go for community food supports, whether it's a food pantry or something else we're funding. And we're also going to be tracking the demand, which we anticipate will be increasing on these programs, to really be able to talk to both legislators at the state level, but also locally, to sort of say this is the impact we're feeling on our locally funded services as a way to help get support or increase support for households who are losing their food purchasing power. Also, another change that was in the Budget Reconciliation Act has to do with Medi-Cal, and that's the resumption of our annual renewal or annual redetermination. This is important because if our households or single adults or seniors who are getting Medi-Cal don't renew, they would get discontinued. They'd lose their health benefits, and very often it's just a paperwork transaction, but sometimes just it could be missed by our clients. So we're doing an outreach effort similar to the CalFresh side. The State Department of Healthcare Services, which oversees Medi-Cal, not the social services, but healthcare services, launched a statewide public information education campaign to raise awareness about this upcoming change. Similar to what DSS is doing, what we're doing across digital media channels, radio, public service announcements on television, social media on Facebook, public display advertising, public transit signage. And then we're going to be, sort of coupling that effort with our local sort of messaging and our local languages. Again, it's important that people understand the change. You get used to a pattern of over 2 years or so where you're not doing 2 years or more, where you're not doing this, and then don't realize that you need to in order to retain your benefits. So that will go into effect in April. It really operationally won't impact households until June. A lot of the households will be able to renew sort of out of what's called ex parte, meaning they don't have to do anything in person. But those who do will definitely, want to be able to get the information out to them. Within our divisions, also sort of in Medi-Cal, on January 26th, the Federal Oversight Agency for Medi-Cal, which is called CMS, or Centers for Medicaid and Medicare Services, notified California that it's the first state in the country to receive approval to offer a targeted set of Medicaid services to adults and to youth who are in state prison, county jail, or youth correctional facility, basically incarcerated individuals. We could do this up to 90 days prior to release, which means that sort of the idea is a continuity of healthcare supports and services upon release, which is really important now given the federal waiver that the state approved called CalAIM, which now even has a different name, but it provides a whole array of community supports beyond just healthcare to clients, community-based supports, including housing and food supports funded through Medicaid. And so getting that to adults and youth who are about to be released in advance is really important to help reentry and to help reduce recidivism and help, sort of reintegrate into society. So our role, of course, with that is to enroll individuals and ensure they're enrolled 90 days prior. We don't provide the services directly. We just ensure that they're getting Medi-Cal so that they can receive the services that Medi-Cal pays for. And then in CalFresh, the office, a lot of, just as an aside, a lot of really good things in our world are happening under the Biden administration that no one really talks about. This incarcerated Medicaid for incarcerated adults is one of them, but expanding Head Start, which is the federally funded preschool program for 3-year-olds. The Office of Head Start, it's a federal office, announced it would expand its definition of public assistance to include families receiving SNAP. And SNAP is the federal supplemental nutritional assistance program. In California, it's called CalFresh. Previously, their definition of public assistance was only TANF or CalFresh and SSI. So this broadens eligibility for Head Start really significantly. We have 70,000 households receiving CalFresh, and obviously some of them have age-appropriate children who would be then eligible for Head Start. So we're in early discussions with the three main Head Start providers in the city to discuss ways to partner with them and inform our CalFresh families with young kids about this really important shift in federal policy. In CAP, in our county adult assistance programs, we continue to improve and refine our business processes to better serve single adults who are on public assistance. So this month we finalized our cross-training and fully launched combined intake and case carrying functions. So we now have better phone coverage, which has resulted in lower call abandonment rates. In fact, a 50% reduction in abandonment rates compared to prior to this change. We have more eligibility workers who can work the service counter, meaning they can help individuals who come in person, and a really more equitable distribution of workload in terms of intakes or applications and renewals. Also in CAP, I report pretty much every month on the restarting of Care Not Cash or CAP benefit package. Right now, all new intakes and most ongoing cases have been transitioned back to the CAP benefit package set of services, which is a guaranteed shelter bed, as well as food support in shelter, and then a pathway, hopefully, to permanent housing. We expect the entire caseload to be transitioned within the next month or so. And then lastly, in CAP, we're starting a pilot with SFBN in March, where CAP workers will take the lead on doing intakes for not only CAP, but CalFresh or Medi-Cal. We currently do that with our CAP outreach worker, but now we're going to be piloting more broadly for drop-ins. Again, it's another way to sort of make the client experience at 1235 Mission for CAP a smoother one, and also hopefully make it more efficient for our employees in CAP to do their work. In our Family and Children's Services Division, several items I want to update you on. The FCS has updated their 2022 strategic plans to sort of highlight areas to focus on in 2023, which include the Family First Prevention Services Act, or FFPSA, youth who have been in foster care for a longer period of time, and then, of course, continue to focus on foster parent recruitment and our resource family approval processes. We're also continue to focus on our high needs youth. We are awaiting a decision from the state to see if we're going to be awarded funding under their program. It's called the Crisis Continuum, which really allows or funds an array of supports that we, along with other counties, can provide to our youth who need a little more intensive behavioral health and other supports, given the trauma that they've suffered through their lives. This will also be presented as part of the budget today. For FFPSA, this I've talked about this a lot. This is the big shift for the federal funding of prevention services. The feds aren't making it easy on us necessarily. They really, the steps we have to take to ensure that we get funding for these services are numerous. The services we provide have to be approved by the feds in what they call their clearinghouse of prevention services. So we have a lot of things we need to do kind of operationally and with our community partners to ensure that we can draw down these fundings. We're continuing to work with our partners to submit the plan to the state on our Prevention Services Act, and developing different sets of services in partnership with our community providers to make sure that they can draw down those federal dollars, and we can provide services well before children might be candidates for, well, they have to be candidates per federal law, but right, providing the services well upstream to families and kids who are at risk to avoid entrance into foster care. That's really what FFPSA is about. We're working on a front-end improvement project around our hotline and emergency response called Achieving Excellence. This is in partnership with Casey Family Programs, their TA supported funding. looking at priority outcomes in the front end and ways to use data to really improve our responses, both on the emergency response when we visit kids in their homes or in schools or elsewhere, and also on our work at the hotline when we get our initial calls. And then in terms of permanency, which is, we're exiting from foster care and getting permanent living situations for our kids, hopefully with families, sometimes with caregivers. We're beginning work with a contract agency called Evident Change to conduct case reviews, interviews, and focus groups to identify strategies for improvements, including in our family maintenance units, court dependency, family services units, and permanency planning. So those are just some areas that I wanted to highlight for 2023 for family and children's. They're doing a lot of work internally and with community partners, and it's good for you all to hear kind of all the I don't want to call it additional work, but all the work that's core to what we do every day in terms of caring for kids who are in foster care or who are at risk. And then a couple agency-wide things. First of all, I want to thank you, Commissioner McCrae, for joining our recent Lunar New Year celebration. We held this across 6 HSA offices from January 31st to February 2nd. We really planned these events to highlight Asian American culture and Lunar New Year traditions. They morphed a bit given the horrific acts of violence both in Southern California and in Northern California on our Asian populations, and so we felt sort of is more important than ever to come together for Lunar New Year to really have a space to process that for our Asian employees as well as our non-Asian colleagues. And then lastly, this is tomorrow. It's our agency-wide Black History Month celebration. It's from noon to 1:30 here at 170 Otis, both in the auditorium here, but also outside. This year's theme is Our Legacy of Resilience. And really, Black History Month, as you know, is a moment to focus on achievements and the esteemed contributions of our San Francisco Black community. The event will be a great opportunity for our agency to come together, as a community and celebrate the undeniable Black resilience with remarks from the mayor, remarks from our executive directors, myself and Kelly Dearman, a lot of performances, local Black vendors, and of course, a great lunch will be provided. Everyone's welcome, so all employees are welcome, and of course, you all have received your invitations, I'm pretty sure. And we hope to see you tomorrow if you can make it, again, from noon to 1:30. Or part of our sort of continued celebration that we've been doing throughout the month. So I will stop there and open up the questions or comments. I'll drink water.
Are there any questions? Hearing none, I'll move on to item 5, which is our employee of the month.
Item 5.
Ray Oya, Families Rising Clerk with CalWorks is the February 2023 Employee of the Month. Ray joined the Families Rising program FAR, formerly known as Project 500, in 2017 as the Project 500 clerk. Prior to joining CalWorks, Ray received his degree in business administration management and worked as a benefits authorizer for the Social Security Administration. Ray has been a key and valuable member of the FAR team. He provided support for both the initial implementation and recent reorganization of the program. He is a computer whiz and has been instrumental in developing business process improvements, staff guidelines, and guidance documents, as well as reports, graphs, and charts he easily creates due to his expert knowledge of different computer programs. Wow, I could use your help. Including Excel, ETO, and the Launchpad case data tracking system. His excellent analytical and problem-solving skills make him a great asset to the FAR team. Nothing is too difficult for Ray. When a problem or question arises, he immediately does his research, trials, and comes up with a possible solution. Additionally, Ray is very detail-oriented, dedicated, and is considered the glue behind the scenes that holds the program together and keeps the team on task to efficiently meet the needs of the program's families. He always goes out of his way, truly above and beyond, to make sure his colleagues have what they need. He has developed work processes for the issuance of services to program families and constantly seeking ways to improve them. Ray is a supportive team member who is reliable and always willing to help anyone at any time. He is also incredibly responsive. Colleagues know they can count on Ray to respond to requests within minutes. He takes pride in his work and is a pleasure to work with. Ray's colleagues appreciate his willingness to teach them technical shortcuts with his team player spirit. Ray is a superstar with follow-up reminders and a superstar with follow-through. He has been in the office every day since the pandemic started and accepted additional responsibilities to support not only FAR, but also to help staff outside of the program. In addition to assisting the CalWorks program overall, he always brings a positive attitude and always greets everyone with a smile. He is kind, thoughtful, organized, and although very quiet, has a great sense of humor, which is enjoyed and appreciated by all. Ray is an exemplary employee. Mr. Rohr, would you like to make some comments?
I'll say a couple things. I'll just say a couple things just for the commissioner's sake. So Families Rising, which used to be called Project 500, was really, I think, part of the legacy of Mayor Lee. And it was born with an interdepartmental meeting we were having. It was myself, as the health director, and other department heads who provide some services and supports to low-income families, whether it's housing or health or what we do in human services. And the mayor sort of looked at us. I don't even remember what we were talking about, but we were making something more complicated than it should have been. And Mayor Lee kind of looks at us, can we just get 500 families out of poverty? And really, that's what he said. And we kind of looked at us, sure. And so that was born Project 500, which is why it's the name. And it's a lot easier to say, let's just get 500 families out of poverty than to get 500 families out of poverty, as the employees in FR and are nodding their heads. And I've seen a lot of the sort of vignettes and the case write-ups about the families they're working with, and the amount, the number of, and the significance of their barriers to actually getting themselves and their kids out of poverty are immense. So the work of this team is very, very hard and very complex. And add to that the pandemic, and add to that a lot of turnover with both management of the group, as well as a lot of the we still calling you mobility mentors? No, they're parent educators. See, things change. So which buttresses my point, which when things change so much and it's such a complex program, having someone to provide the stability like Ray, who's been there since the beginning, is very, very important. So thank you for being the rocks for this very difficult project, and we hope to continue it and really have it be a legacy for Mayor Lee to have the outcomes that we're having for our families. So thank you, Ray. It's very well deserved. And thank you.
Board members of the commission, I'd like to thank you for letting me join the month. And I'd also like to thank everyone here in attendance to this. And I'd especially like to thank our parent educators who, as you said, do a lot of the really hard work, to keep this program going. I'd also like to thank, our managers, Gloria, and our previous manager, Terry and Susan. They're the ones who, YCS visionaries who carry our program forward. And also I'd like to thank, Redora, for showing me the ropes. And also I'd like to mention our analysts, who inspired me to not be afraid to learn a new program. And yeah, that's how I came to be as knowledgeable as I am. And I don't. Got me off guard. I don't know if I can promise better, but if what I've done to get this far, I can promise that I can at least do the same, do more of the same.
Item 6 on the agenda is the consent calendar. Do any of my fellow commissioners want to remove an item for individual discussion? Is there any public comment? Can I ask for a motion to approve?
So moved.
All in favor? Aye. So moved. Agenda item 7A is the resolution to hold in-person meetings with some members possibly appearing remotely. Are there any comments from the commission?
Yeah,
Is there any public comment?
you guys,
Hearing no request to speak on the item, we close public comment. Is there a motion?
So moved.
All in favor?
Aye.
So moved. 7B is consideration and possible action regarding the Department of Benefits and Family Support and Human Service Agency fiscal year 2023. 2024, 2025.
Good morning, commissioners. Am I speaking through this? Is there one of these that, how would you like? Is it better for me to be in here? Okay, I'll use one of these.
Binder.
Which one would you like? Is it mic 9 or 10?
Oh my God. Open the binder.
Better to use this one.
It's better to use this.
Whatever you use, you need to stand.
That's it, right?
Thank
there.
you. Abhishek.
We can switch this.
Jab.
Okay. I have this kind of Butch Cassidy and the Sundance Kid reaction where I sort of feel like I like to move around, but
Get out of
I'm
the
not
way.
going to today.
This- That's the budget crap. What do you?
Yeah.
No, he's gonna do the budget. Hi.
Yes, you have a packet that includes a lot of backup material. I'm going to speak just to the PowerPoint presentation. So we were here talking about the budget from the start on January 26th. And in that meeting, we reviewed the budget context. We reviewed our current year's budget. Now we're coming back with a proposal for our, oh, that's better, from our budget next year. And I will walk you through the sort of the big picture view of that and the numbers. Trent will then pick up and talk about specific departmental initiatives that are funded in that budget.
Yes.
David, I'm sorry about that.
Okay. It's okay. So I guess I should start off by saying that we're in a much more conservative budget climate this year than we have been in the last few years. And as we talked about a few weeks ago, the city has estimated a $728 million shortfall for the next biennium. And as a result of that, they have directed departments to make 5% reductions in the budget year and 8% reductions in the second year of the upcoming biennium. And they apply those percentages to what are thought of typically as discretionary costs in the budget. So most general fund costs in HSA's budget are not in fact discretionary. There's about $40 million of discretionary cost, and it's spread primarily in our welfare to work program, our CAP program, and our housing displacement funds. And we are not required to cut from those programs specifically, but when we're building the budget, that $40 million becomes the amount where we apply the 5% reduction. So that results in a 2% reduction target. And that target is for DBFS, HSA administration, and DOS together. So collectively, we have to come up with a reduction of $2 million in general funds. We're also in a context where the state is facing a big shortfall. The governor's budget assumes a $22 billion shortfall and makes a number of adjustments to balance the budget. Luckily for HSA, none of those adjustments really impact human services spending in a profound way. We also are in a situation where there are slight increases in 1991 and 2011 revenue. As you recall, those are dollars that come to the agency through the state sales and use tax and through the state vehicle licensing fee. They are not growing as fast as they have in the past, but they are still growing. There is also one-time money in the Medi-Cal program, and this money is associated with the end of the public health emergency. And we have elected to receive all of that money in the next fiscal year. So as Trent has mentioned on several occasions, the public health emergency is ending, and we are going to have to start doing redeterminations on Medi-Cal cases, which have been in suspension for a long time. The state put in extra money to allow counties to be able to work through that increased workload in the Medi-Cal program. And that work starts at the last quarter of this fiscal year, but we've pushed all of the money for that extra work into next fiscal year because we have room in this fiscal year's budget already. And so that adds several millions of dollars to our program. So we have a little bit of room to play. We are able to cover our reduction target with new revenues, and we have a little bit of room to move around, and we have used it to solidify our core functions. We've used it to make some substitutions of positions to move positions around our budget to places where they're more needed. And we have resulted in a budget that has no cuts in either program benefits, CBO costs, or benefits to clients or positions. Next. So if we look at the big picture view, and we always start off with a program. Thank you. We have a 4.5% overall increase in our budget. And if you look at the percentages associated with each slice of the pie on this, you'll see that they're about the same from year to year. Program support represented 23% of the budget in the current fiscal year, and we're proposing a budget where program support represents 23% of the budget. And that's true pretty much all the way around the pie. There are a few items I'd like to specially mention. If you look at the CalWorks program, you see there is a relatively substantial growth in CalWorks. That's mainly in the aid budget. And the reason for that is when this year's CalWorks budget was built, we didn't realize how much the CalWorks grant was going to go up. In the governor's January budget, there was about a 7% increase in the CalWorks grant that was anticipated. When the state legislature ultimately passed the state budget for the current fiscal year, the CalWorks grant increase was 21%. So we are catching up by adding enough money to cover the full CalWorks grant going into the next year. And we're also adding another 3%, which is what the governor projects for the CalWorks grant increase for the coming year. So that accounts for a big piece of the increase in the CalWorks budget. In FCS, there's also a relatively large increase. And here the story is that there are a number of CBO-based expenditures that we built into the budget that are new. There's a crisis continuum pilot project that's starting. There's some additional grant money from the state Housing and Community Development Program. There's an expanded contract with AFS to support short-term placements early in after children have been removed. And then there's additional money that's put into the budget for Families First Preventive Services Act spending. So that appears mainly in the CBO side of the Children and Family Services budget. Can we go to the next slide? So, sure.
When we look at the page and go back to the bottom of the page before, are there any of these, in these two particular areas, these increases that you feel were outside of your operating goals, namely needs, services? Was there some increases that were other than that area, those areas?
I mean, the budget was built in a way that takes into account lots of changes in cost. So for example, the biggest one in most city agencies and in HSA are around salaries. So there are labor contracts, and for next fiscal year, there is going to be a 2.5% increase in salary on July 1st, and then another 2.25% increase on January 1st. So we built a budget that takes that into account. We have not yet built into the budget what we call cost of doing business increases. Those are increases in the contracts with community-based organizations. It's not that we don't intend to build those in. We just do that later in the budget making process. And the reason for that is the mayor's office works on a citywide cost of doing business increase, and it hasn't given the agencies that number yet. In the current year, there was about a 4% increase for cost of doing business for CBOs. And there will be something this year. We don't have the number yet. So that's not in this budget at this point, but that will be another area where there will be several millions of additional dollars.
That is what it is, our agency programs. Yeah.
May we go to, yes. So the next way we look at the budget is around full-time equivalent employees. And what you'll see here is that in most of the slices in the pie, the numbers are very similar from year to year. There are a few minor shifts from one program area to the other. The big change is in SFBN. And in that program, you can see that the number of FTE goes up by 20. There is a reason for that that has to do with new staff that was funded in the current year. So in this year's budget, we added 42 new positions in SFBN. We did that because there was a large increase in the Medi-Cal and the CalFresh caseload. We funded those positions only for half a year. So only in half of this year were those positions funded. As we go into the next fiscal year, we fund those positions for the whole year. And 42 cut in half is 20. And that's the difference between this year's SFBN staffing and the budget year's SFBN staffing. So we make those full year positions in the budget. So it's not adding new positions per se, but it is funding them for the full year. Okay, next slide. So when we look at the sources of revenue for our program, you will see again, they are very similar. The percentages that are broken out by the different revenue sources are very close from year to year. And as you recall, we have revenues from the federal government. We have revenues from the state government. We have the realignment revenues, which I mentioned before, which are funded by sales and use and VLF. We have a tiny bit of money that comes in from work order recovery, and we also have general funds. And what you'll see here is that there is some growth in general funds, and that is largely growth that covers salary increases and, well, mainly salary increases and some CBO cost of doing business increases from the past year. And we have some growth in what we call AB 85 realignment. This is realignment money that is completely dedicated to funding the state share of the CalWorks grant. And we have some growth in federal revenue, and that is to cover the federal share of the CalWorks grant increase, It covers an increase in childcare that is bought for CalWorks recipients in the Welfare to Work program. And it covers the additional Medi-Cal administration money that I described before. So small differences, but they're very targeted to particular things. Maybe go to the next slide. So the next slide is the one where we look at the categories of expenditures. And here, you know, we break the budget out into salaries and fringe benefits, professional services, aid payments, and work orders. And I'll just mention that once again, the categories are very similar from year to year. So it's a budget in general that follows the current year's budget pretty closely. Salaries do go up, as you can see, and they go up for two reasons. One is the additional 20 FTE that I mentioned, and the other is the additional COLAs that I mentioned. Fringe benefits are staying pretty flat. And the reason for that is fringe benefits include a bag of different benefits. Healthcare costs have gone up. Retirement costs, given the way the city calculates retirement contributions, have actually gone down, and they've offset the reason is because we do averaging over multiple years. We look at stock market growth over multiple years. So last year was a pretty bad year on the stock market, but the years before it were pretty good. So we're still benefiting from that increase from prior years. We have some other minor shifts here. CBO grants, as you'll see, go up. The big story here are the FCS CBO contracts that I mentioned before, and a little shift within the CalWorks housing support program, where we are spending more money through the CBOs that work on that program and less money through our direct payments of rental subsidies. The CBOs are in fact making payments of rental subsidies too, but they're coming through a different bucket. And then the work order expenditures have also gone up. This is mainly an increase in our work order, and a work order is the means by which we pay another agency to do something. So our work order for the Department of Early Care, which buys child care services for us, has gone up because more CalWorks child care expenditure is in here. Also a little bit more FCS child care expenditure. And then there are also other much smaller increases in the work orders that we have with the Citywide Department of Technology, the Citywide Real Estate Department, and NHSH, which administers or which pays for transitional housing program expenses that benefit FCS clients. Maybe we go to the next one. So there are a number of items that are not in these numbers that we don't have final numbers on and won't, I think, for several months, but these are mayoral initiatives that we're discussing with the mayor's office at this point. We have over many months discussed food support program. Cindy Lynn has brought many CBO grants to you, and those are all funded within the food support program. And we are talking with the mayor's office about possible continuation of that program going forward. This program is one that really grew out of the city's COVID response. And so as we're moving to the post-COVID period, we're having to work with the mayor's office to figure out what this looks like going forward. As has been mentioned on a number of times, we do sheltering for the city in the event of a natural disaster. We are at the present time exploring the possibility of acquiring a site that we can use as a shelter. In the past, we have generally used either rec and park sites or sites lent to us by faith communities. for short periods of time. And in this period of time, we're exploring the possibility of acquiring a site that HSA will have for sheltering. We have been working on a number of housing programs. Trent will talk a little bit about this in his remarks, but there are 4 programs that got a good bit of one-time money over the past few years. One of them is the CalWorks Housing Support Program. We've been spending at a relatively high rate about that in that program. And we are in a position where we're trying to figure out how do we ramp down gracefully so that when the one-time money goes away, we will continue the program with ongoing money. And then the last item has to do with our city attorney work order. We buy legal services from the city attorney's office, and we have been overspending that budget for a number of years now, and we're trying to true it up. So those are issues we're still working on with the mayor's office, and before we get to a final budget, we will have worked those out. So I'd like to turn this over to Trent now to talk about particular initiatives that we've dealt with in this budget process or that we're dealing with in this process.
Before I do that, do you have any questions for Dan for his portion of the presentation? If not, I can. Okay. Commissioner Khan, you're good? Are you good? Yeah. Okay. All right. So I just have a couple slides here on initiatives that we are proposing in our budget. The first one Dan had mentioned, but the governor in 2021 to address the homeless crisis, of course, don't call it a crisis across the state, significantly expanded 4 programs that we operate. 3 of them are in Department of DBFS, Benefits and Family Support. The other one is in DOS. You may ask, why aren't they in the Department of Housing or Department of Homelessness and Supportive Housing, HSH? These programs are specifically tied to and are for recipients of our benefit programs. And really the idea is increasingly, as for a number of reasons, one of them is housing affordability, we have encountered more and more families and single adults who are receiving our programs and services encountering barriers to either remaining housed or barriers to finding housing. And so it really, in many cases, undermines or makes it more difficult for us to achieve the goals of those programs. At CalWorks, for example, the overarching goal is employment and a movement and a path towards self-sufficiency. In our SSI advocacy program, the goal is to get the individual onto federal disability and off of our assistance. And all of those things that we do are more difficult when our recipients are homeless or teetering on homelessness. The third one is in child welfare, bringing families home. The idea around that program is for parents whose only barrier to reunification is the fact that they don't have a permanent place to live. The program provides a housing subsidy and support and services to reunify and get the child out of foster care and back to his, her, or their parents. And so we received significant, these programs were already in place prior to 2021, but in 2021, the governor and the legislature provided a significant amount of one-time dollars to be spread over a number of years. Great news, of course, we were able to expand our programs, but the difficulty that one-time dollars in the context of housing support programs is that generally our housing intervention is in the form of a housing subsidy or a rental subsidy, right? Which is ongoing. We try to make the rental subsidy, sort of shorter term in duration to exit a family or a single adult onto housing that the household can afford, but of course in our housing market that's more and more difficult. And so we're facing this sort of end of this one-time money, yet we have a number of households, families or single adults or seniors who are getting a housing subsidy. So sort of what do we do? Either we transition them onto another form of subsidy that's more permanent through working with the Department of Homelessness and Supportive Housing, working potentially with the Housing Authority for housing choice vouchers, or we try to exit them off into housing that they can afford. So that is sort of what we're doing. recognizing the difficulty of doing that, what we're doing budgetarily is potentially seeking general fund, city general fund to backfill when we lose that state money in beginning in 2023-24, but extending beyond. And so that's why this slide is in there. It's sort of this cliff that was created through the because of the way the governor and the legislature funded these programs. So the advocacy is a bit two-pronged. It's one is in the legislature through our partners up there saying, hey, this is a cliff that not only San Francisco County is facing, but 57 other counties who run these programs. But in the event that that's not made whole or partially whole, we would look for general funds to help us do that transition. So that's why that's listed here. Next slide. So in SF Benefits Net, I mentioned in my report the resumption of Medi-Cal renewals. Well, with the requirement to resume that for 90,000 households, that's a significant workload that we have not incurred since March of 2020. So in order to achieve this workload, to ensure that households continue their Medi-Cal coverage, we are certainly budgeting significant overtime. We've received state dollars to do this, as well as aggressively filling existing and new eligibility worker positions that we had received in prior budgets. So that's part of the budget proposal to the mayor as well. Because it's Medi-Cal, the funding is generally state and federal money, not general fund yet, but we still have to recognize the revenue in our budget. The second area of SF Benefits Net is a neat project. It's what we're calling it's a mobile office van to do benefits enrollment, and San Diego County has had this, and we actually took a look at it when we were down there for a conference last year. But it really is, what it says it is. It's a van that has all the capabilities to enroll people into our benefits programs, and you can. It's obviously on wheels, so it can roam, and we can put it at our food support events, our food pantries. We can issue EBT cards. We can prioritize reaching different communities and go to where they are rather than having families, single adults coming down to one of our many offices. So we actually applied for a grant for this, but we also have, in case we don't get the grant, a placeholder for general fund to support this initiative. It really is consistent with a lot of what we've been doing about partnering to sort of underserved or historically underserved communities and making our services more accessible, whether that's through accessing our services through the web or whether it's holding webinars with community-based organizations to better help our clients. This is just another way to say, hey, we have a lot to offer you. You may not know about them. It may be hard to access. We're trying to make it easier for you. And then the third initiative I just want to highlight is the permanent expansion of our diaper bank services for Medi-Cal families who are receiving Medi-Cal. This has been a really successful program that started with CalWorks and then to CalFresh, and it's really simple. It's provision of diapers, which are very expensive, especially if they're bought at, say, a corner store. Provision of diapers to families with very young children who are of diaper age, and so we're proposing to make that permanent in the budget moving forward. Next slide. Okay. Family and Children's Services. I mentioned in my report the FFPSA, or the Family First Prevention Services Act, which is the federal funding to fund prevention. Coupled with that is a change in the way that over the past 6 years or so, we have received funding through the 40 waiver. There's a mismatch there in funding, meaning it's a nice way of saying potentially fewer dollars through Family First than through the 40 waiver. So we're sort of maintaining the level of service in that division, recognizing the loss of federal revenue in one area, the additional federal revenue in another area, and sort of smoothing out the cliff that otherwise we would have seen at the end of the 40 waiver as we transition into these new funding sources. For those dollars, we're looking at $2 million for 23-24, to support the prevention services through our family resource centers and expansion of their services. Again, this is reaching families and kids way upstream before things happen with the family that would require our intervention, meaning, removing children and putting them into foster care. And this is in partnership with community-based organizations that run these neighborhood-based family resource centers. And then I also mentioned in my report, funding for a children's crisis continuum pilot program. And this is a whole range of programs for kids who really have intensive needs, particularly around mental health, that will better enable those youth with the needs to thrive and to be in placements where they can remain and really transition into adulthood with services and supports that we can help provide them through this funding. Again, we replied to the state for this. I'm optimistic we'll get the dollars, but the funding nevertheless would be in our budget. And then lastly, just in program support and facility planning, we continue the planning effort that really was paused with COVID to relocate our operations from this building at 170 Otis to, given the seismic assessment of the building, to other neighborhoods potentially in the city. We're looking at sites in the southeast, near 3rd Street, as well as other sites, and sort of continuing that work, which really, I say we paused during COVID, and we paused during COVID for obvious reasons, but the other reason is really the nature of the way we were performing our work and delivering services changed permanently, right? We employees come in 3 days a week instead of 5. We're able to offer services remotely. Our family and children services employees largely perform remote work and don't necessarily come into the office as they're out visiting kids or they're in court, and they're doing work in the community. So because of that, our space needs have changed significantly to when we started the planning in 2019. And so that's what we're sort of trying to balance, how many square feet do we need given the way that we deliver service and given the number of employees that are on site every day. So I believe that's the last of my slides. What's the next slide?
Yes. So just the final slide is on timeline. Obviously, we were here on the 15th today. This is the second meeting, and this is the meeting at which we ask your approval for submitting this budget. We have a due date of submitting a budget to the mayor's office on February 21st. And then after we do that, there will be a series of discussions back and forth between the agency and the mayor's office, which will result in the HSA portion of the mayor's budget that will be released on June 1st. And then we will go into hearings with the Board of Supervisors, and then we will have a budget early in the next fiscal year. We'd be happy to answer questions, but we are asking for your approval to submit this budget.
Any comments or questions from the commission? Is there any public comment?
Morning, Living Wage Coalition. So inflation has been running stubbornly high.
The figures for January and the consumer price index was 6.4% increase nationally. On July 1st, under the minimum wage law, the minimum wage in San Francisco increases automatically to $18.07 per hour. Under the minimum compensation ordinance, the minimum wage for workers at for-profit contractors with the city automatically increases to $20.22 per hour. At the airport, the minimum wage will be $20.72 per hour. For 3 groups of workers, the wage under the minimum compensation ordinance, the wage doesn't automatically increase on July 1st unless money is put into the city budget. That's for IHSS home health care aides, for city-funded nonprofit workers, and for CalWorks parents who are working for their public benefits. It's interesting that The mayor spoke at a Lunar New Year dinner for SEIU 2015. And in her remarks, it was apparent that she was under the impression that IHSS home healthcare aides were currently making more than $20 an hour. She didn't know that they're only making $18.75 per hour right now. So please assure us that you're sending a budget to her that makes it so that they're above 20 an hour. For workers at city-funded nonprofit agencies, you don't all have to wait until the mayor's budget office puts money in there. When that budget is submitted on February 21st, Dan Kaplan is signing a budget cover sheet that says that he took into consideration calculations for wage increases for the city-funded nonprofit workers with which the Human Services Agency contracts. So you can all make that so right now. So those nonprofit workers know that on July 1st, that they'll be getting a wage increase. And we also have someone on Zoom who's going to be speaking. Thank you.
Are there any other public comments?
Yes. My name is Austin Bradford, and I am with the San Francisco Living Wage Coalition, speaking on the budget. And the consumer price index, which is used for measuring the rate of inflation, it increased 5.6% last year for the Greater Bay Area. And for low-wage workers, this amounts to a dollar wage cut. And this is not a budgetary pinch, but a crushing financial crisis. And the mayor's budget instruction said that she is prioritizing recovery of the local economy and accountability and equity in services. When low-wage workers have more dollars in their pockets, they spend them in the local economy, which builds a healthier economy from the bottom up. City-funded nonprofit workers are providing essential services on which the residents of San Francisco depend. Without wage increases, they are forced to leave their jobs. Many of these are workers of color who are being displaced from the San Francisco Bay Area. And nonprofits are raising a crisis of high turnover and losing experienced workers. The residents of San Francisco face the prospect of not receiving the same level of efficient services on which they have come to rely. And so I have a question. Is your department providing to the nonprofit organizations with which your department contracts increased funding to raise the minimum compensation ordinance wage rate from $17.90 to $18.90 per hour on July 1st? And to provide a 5% cost of living adjustment to other city-funded nonprofit workers above the minimum rate.
Are there any other public comments? Brent, do you have a comment? Okay. Hearing no request to speak, we will close public comment. Is there a motion to approve the Department of Benefits and Family Support and Human Services Agency fiscal year 2023 to 2024 and 2024 to 2025 budget proposal? Commissioner Sam? Yep. Raised his hand. Thank you very much. All in favor? Any opposed? No. Thank you. Item 7C is a request for authorization to modify the existing grant agreement with La Cucina presented by Tommy McLean.
You're a little bit taller than the previous person, so let's get that. Wait.
Oh, sorry. Good morning, Commissioners, Executive Director Roar. My name is Tommy McLean. I'm with the citywide food access team. And I'm before you today to ask authorization to modify the existing grant agreement with La Cocina to add the provision of prepared meals to delivering innovations to supportive housing or DISH housing sites for the period of February 1st, 2023 through June 30, 2024. This would be in the additional amount of $250,000 plus a 10% contingency for a total grant amount to not exceed $445,738. The purpose of this modification is to support a partnership between La Cocina and DISH that was voted on and approved by Tenderloin residents and stakeholders in the recent Tenderloin participatory budget process. So Mayor Breed allocated $3.5 million for a participatory budget process in the Tenderloin. About 1,300 Tenderloin residents and stakeholders participated and voted. And this was one of the programs that they voted to support from that budget. La Cocina is a nonprofit business incubator for working class women of color, immigrant women, to help them grow and expand food businesses. And La Cocina has a food hall featuring some of these entrepreneurs in the Tenderloin. DISH is a permanent supportive housing provider with housing sites in the Tenderloin. And so this modification would support the delivery of approximately 20,000 meals from these La Cocina entrepreneurs in the Tenderloin to residents at 5 different DISH housing sites, 3 days a week for approximately 9 months. So very much in line with the theme of this grant and the underlying theme of this RFP that we had put out, which was really community cooking for community. So the La Cocina entrepreneurs cooking for their neighbors at these DISH housing sites. Thank you, commissioners. If you have any questions, Leila Parar from DISH and Monica Barboza from La Cocina are present on the Zoom. Thank you very much.
Thank you. Are there any comments or questions from the commission? Is there any public comment? Hearing no request to speak on the item, we will close public comment. Is there a motion? Is there a second?
Second.
All in favor?
Aye.
So moved. Thank you. Item 7D is a request to modify the existing grant agreement with Unity Care Group, Jeffrey Nagy.
The guy. Good morning, commissioners. Jeff Nagai, a program support analyst with HSA's Family Consulting Services. As the agenda stated, the Department of Family Support seeks the commission's authorization to modify the existing grant with Unity Care Group for the period of March 1st, 2023 to June 30th, 2025, from an additional amount of $248,467 for plus a 10% contingency for a revised total amount not to exceed $6,965,758. The purpose of this modification is to increase the capacity of the program to serve up to 25 newly referred emancipating and former foster youth, and add another 1.0 FTE housing case manager and increase funding for direct housing assistance. Unity Care provides housing navigation and housing case management, including 36 months of independent living skills support and post-housing stabilization services. They've provided these services to 40 emancipating and former foster youth, housing 36 of those youths with FYI or emergency housing vouchers. Unity Care also provides bridge hotel stays and emergency rental subsidies. I'd be happy to answer any questions that you have about this program or the grant. We're also joined by Sheila Mitchell, the Chief Executive Officer, and Kevin Sharps, Director of Housing from Unity Care Group Online.
Are there any comments or questions from members of the commission? Is there any public comment? Hearing no request to speak on the item, we will close public comment. Is there a motion?
So move.
All in favor? Aye. So moved. Thank you. Item 7E is the request to modify the existing grant agreement and sole source waiver with Help a Mother by Perry Weisberg.
Hello, commissioners. My name is Perry Weisberg. I'm an analyst with our agency's planning unit. Item E, as you see, requests to modify our existing grant agreement with Help a Mother Out and the sole source waiver for the provision of diaper bank services. The period is March 1, 2023 through June 30, 2026, and the additional amount is $1,826,497 plus contingency for a total not to exceed of $4,216,260. The Help a Mother Out nonprofit operates our agency's diaper bank, the San Francisco Diaper Bank, which provides diapers to families with infants and toddlers who receive Medi-Cal, CalFresh, and CalWorks. This is one of the initiatives that you heard about earlier as part of our BFS budget initiatives for this coming year. I wanted to note this program is an important way we support low-income families raising young children in San Francisco. And with the modification, our aim is to distribute 3,250,000 diapers a year to low-income families. Glad to answer any questions you have.
Are there any questions from members of the commission? Comments? Is there any public comment? Hearing no request to speak on the item, we will close public comment. Is there a motion?
Second.
All in favor?
Aye.
So moved. Thank you. Item 7F is the request for an approval of sole source waiver and authorization to enter into a sole source contract agreement with Zoom Video Communications presented by Alex Leontief.
Good day, President Khan, Commissioners, and Executive Director Rohr. Thank you. My name is Alex Leontiev. I am the Business Engagement Team Lead with the IT Department. I'm here to request approval for a sole source waiver and authorization to enter into a sole source contract with Zoom Video Communications Incorporated for the period of May 27, 2023 to May 26, 2026 in the amount of $302,295 plus a 10% contingency for a total amount not to exceed $332,358. The purpose of the contract is to procure licenses for the provision of licenses for the proprietary application and software Zoom services, which includes services branded as Zoom Meetings, Zoom Chat, Zoom Phone, Zoom Webinars, and Zoom Rooms. These are all different functions of these services. HSA uses Zoom software to support clients and conduct meetings and training with non-city employees and people. HSA also uses Zoom for hosting conferences and other public-facing meetings. HSA would like to continue the subscription services for these software licenses. Zoom software is the application of choice for clients and outside city people to use when speaking with HSA staff, particularly for family and children services and for our human resources department conducting interviews and training. Zoom is easier to use for many clients and reduces the burden on social workers to train clients on technology, allowing them to just focus on client issues. I thank you for your consideration and will be happy to address any questions there may be.
Are there any commissioner comments? Is there any public comment? Hearing no request.
Up on Telegraph Avenue in Oakland, about 9 miles to your east.
Sorry. Hearing no request to speak on the item, we will close public comment other than my phone. Is there a motion, please?
So moved.
All in favor? So moved. Item 7G is the request for approval of a sole source waiver and authorization to enter into a sole source contract agreement with Launchpad Careers Incorporated, presented by Andy Beatley Hagler.
Good morning, President and Commissioners. My name is Andy Beatley Hagler, and I am the program monitor for the Launchpad contract. The Department of Benefits and Family Support requests approval of a sole source waiver and authorization to enter into a contract with Launchpad Careers Incorporated for the period of July 1st, 2023 to June 30th, 2028, in an amount of $2,585,331 plus a 10% contingency for a total amount not to exceed $2,843,865. The purpose of the contract is to renew licenses and to provide technical support for the Launchpad database. Launchpad is a proprietary software application for HSA that was initially created to manage the employment services we deliver to clients in the Workforce Development Division. HSA has expanded Launchpad to manage various additional client services across our programs. The software application is built on a Salesforce platform and utilizes the latest technology in a secure cloud environment. It has replaced numerous paper forms and tracking sheets and has allowed HSA to streamline its operations. The contract includes this platform, licenses for HSA staff, community partners, and employers to use the technology, as well as technical support from Launchpad. The contractor will provide licensing, hosting, and maintenance of Launchpad on the Salesforce government cloud platform, providing functionality to support HSA programs. Services include, but are not limited to, platform licensing, data center operations, secure hosting of data, all software and licenses required for hosting, maintenance of hardware, application monitoring, regular backups and recovery functionality, error correction, and browser compatibility testing. Contractor will provide toll-free phone and email-based support to users, as well as project management, including development of the system specifications, oversight of custom programming, and project reporting as well. I'm available to answer questions regarding the services. Melissa Jenkins, CAO of Launchpad, is here. And Craig Lottie and or Chris Shaw are here online as well, I believe, from HSA.
Can you raise your hands for a second so I can say thank you for being here? Oh, they're not here. Oh, they're online. Okay. Here. Are there any questions from members of the commission? Is there any public comment? Hearing no request to speak on the item, we'll close public comment. Is there a motion?
So moved.
All in favor? Aye.
Aye.
So moved. The last item of the agenda is public comment, and we've had no public comment today, but I'm going to open it up for public comment. Is there any public comment? Hearing no requests for public comment, our meeting is adjourned.
Okay.
Donna,